The battle against COVID is the worst it's ever been in Florida, forcing hospitals to make big changes and quickly. This is Nightside. I'm Ryan Bass. Glad you're here with us. Carolina has the week off. BayCare was the latest local hospital to say they're cutting back on visitors on top of their halt on some elective surgeries. But a lot of this is new, so take a look at your screen. We're going to run through it right here. Advent Health, Wesley Chapel, and Sarasota Memorial started limiting visitations today. Advent Health, Pinellas, Manatee Memorial, and Lakewood Ranch, they start tomorrow. Advent Health in Dade City and Zephyr Hills, they begin on Wednesday. And this is why our entire state is a COVID hotspot. This is a timeline from the CDC. 1 month ago, we were seeing moderate levels of transmission, and in a matter of weeks, everything changed. Look at the bottom right there near Florida. Nearly all of our counties are now considered to have high transmission. You see those in red there. The one outlier is Glades County, which is basically just one level below. The Delta variant is feeding on the unvaccinated in our state, and our low rates are creating the perfect breeding ground for COVID-19. Now, we're still waiting for today's case totals and the tally from the weekend, but it's still jarring to see that we broke a pandemic record from Friday with 21,000 new cases in one day. Nobody in the country has ever had more than that in a single day. And if that wasn't bad enough, our hospitals are getting hit hard too. Today, there were 10,389 COVID patients in our state hospitals. That's up more than 1,000 patients from just Friday. We've broken last July's record now in back-to-back days. We're trending worse than anything we saw in 2020, which is that blue line. And more than 95% of COVID patients are still unvaccinated.
It's the rate of escalation that is startling. We went from 2,000 to 10,000 cases last year in roughly 60 days. We've gone from 2,000 to 10,000 cases in 27 days with this Delta variant surge. And of course, it's attacking younger people. Whereas before, someone in their 20s might get COVID but not require hospitalization, that is the age group that we are now seeing in the hospital.